Let's continue our work, students. I uploaded file with clinical guidelines. Please submit. That is, you can download it from chat. Now let's discuss which usual recommendations for lifestyle modification for patients with hyperlipidemia. It should be which should include diet correction, those physical exercises, an ideal weight or achievement of an ideal or optimal weight, smoking, and a relaxation training too. For patients with family predisposition to cardiovascular or to atherosclerosis development, it's necessary to conduct early preventive measures before 50 years earlier for more effective prevention of coronary atherosclerosis. On this picture, you can see 3 groups or 6 groups of food, nutritional factors which contain different concentration of cholesterol. Left column, high concentration, high level of cholesterol, red meat, beef, shellfish, sausages, butter, and bacon. Middle, moderate concentration, which we can apply for replace red meat or shellfish, margarine instead of butter, and food with 0 concentration of cholesterol, which includes legumes, meat analogs, herbal vegetable meat analogs, and olive vegetable oil, virgin oil, olive oil, seed oil, sunflower oil, and others. So, if patient needs a modification in his diet with minimization of cholesterol level, he should increase the part of food or oils with vegetable components. Identifying process of early risk atherosclerosis includes analysis of patient's family tree, genetic tree, especially detection of vascular lesions of the heart, brain, intestine, lower limbs, if he's close relatives. Severity of atherosclerosis in person engaged in manual labor, much lower than for inactivity. Low physical activity, at least 10 hours a week. The role of polyunsaturated fatty acids. You should know there's very famous acids, so-called omega-3 fatty acids, eicosapentaenoic acid, doxosahexaenoid acid, and alpha-linolenic acid. These fatty acids can provide a positive effect on lipid metabolism, reduction of LDL production. Regular intaking of this food which contain these acids reduces triglycerides level by 25-30%, increase HDL, cholesterol level by 1 to 3%, and additional controls at doses of 3 to 5 grams per day. Maybe risk of bleeding. You can see the fish which contains high concentration of these acids, useful fatty acids. Especially, of course, sea fish or ocean fish. It's information, historical information that in ancient times was ideal. Not ideal. In ancient time, ratio of this omega-6 acid from animal fats and omega-3 from fish was equal. Ideal concentration 5 to 1. Ideal ratio. But now, for example, current time in the United States, for example, 2 times omega-6. And omega-3 is not enough. What about importance of preventive work, additional motivation of patient and doctors? Success preventive work depends on, of course, on level of the doctor's knowledge about effective methods of early detection and prevent disease. For effective organization of preventive work, doctors should know more information about patient's life, views and convictions about risk factors to which it is exposed. The disadvantage of previous approaches in organization of preventive work affected mainly on one risk factor. Modern task of preventive work to impact on all those who have an increased risk and its maximum reduction on all directions. Correction. As for a role of physical activity for cardiovascular disease, cardiovascular disease risk, we have to know, to know that physical inactivity or insufficiency of physical activity less than 30 minutes daily increases risk regardless of cardiovascular disease. Cardiovascular disease risk in people with low physical activity twice as high compared to the physically active persons. Risk of hypertension development in physically inactive people up to even 53%. By other words, benefits of physical activity from other hand. Main benefits of enough physical activity, for example, classes 3 times a week for 45 minutes during 6 months usually lead to reduction, according to results of special clinical trials, led to reduction of blood pressure level, systolic, more than 10 millimeter mercury, average level of reduction, diastolic between 7 till 12.5 millimeters mercury. Excuse me. Except correction of blood pressure level, regular and moderate physical activity reduces the level of total cholesterol LDL cholesterol and even raise high-density lipoprotein cholesterol and reduce the risk of coronary heart disease and diabetes 2 and hypertension on more than 30%, so significant. On this picture, you can see a very popular type of physical activity now in different countries, and in Russia too. It is Nordic walking, special sticks, imitation of ski process, but this kind of physical activity is more effective because this walking involves almost 80% of muscle groups, patient's body, in comparison with around 50% muscle groups during usual walking. On this slide, you can see American Heart Association recommendation for physical activity in adults. General recommendation for patients without any cardiovascular diseases for maintenance of cardiovascular health, recommended at least 30 minutes daily or at least 5 days per week for a total 150 minutes. Walking or moderate intensity aerobic activity, or at least 25 minutes of vigorous aerobic activity such as jogging, running, at least 3 days per week for 75 minutes totally. Or, as you see, a combination of the two, both kinds of physical activity and moderate or high intensity muscle strengthening activity at least 2 days per week for additional health benefits. Try to remember this information, try to recommend for your relatives and for your future patients. As for patients with increased low blood pressure level and increased cholesterol level, for them may be recommended an average, not less, at least 40 minutes, moderate vigorous intensity aerobic activity, 3 or 4 days per week. Together, of course, with muscle strengthening activity 2 times per day, 2 days per week. Some information about smoking. Smoking is a very famous, serious, significant risk factor of cardiovascular diseases. Regular smoking increases the cardiovascular disease risk for myocardial infarction and for strokes 2 times. 2 times. For correction or for organization of gradual smoking cessation, we can apply some technology, some approaches. One example of technology you can see, this technology you can see on this slide. First step of this process of this algorithm is creating of patient's motivation. It's basis of any changes patient's behavior and for smoking cessation too. Next step is identification of possible situations in patient's life that provoke smoking. It can be stress, it can be some parties or any other situations which patients should avoid in this period. Phasing out of cigarettes next. And the most important process, smoking cessation. Cessation from certain date, from Monday, from first day of month, for example. This process we have to support by any social interaction, prevention of failure, social support from relatives, from friends, from colleagues, from parents sometimes. In case of disruption, smoking relapse is not failure. This is part of cycling process leading to smoking cessation, and then we should start all over again. And now let's return to nutrition. Nutritional risk factor in any cardiovascular disease development plays a very important role. Unhealthy nutrition, animal fats and high concentration of sugar, inadequate intake of plant foods, lack of plant foods, largely determine development of nutritional related diseases, which includes also coronary heart disease, obesity, diabetes, and others such as maybe arthritis. It can lead to the reduction in life expectancy, impaired growth and development. The main principles of healthy nutrition is that energy consumption should correspond to energy entering to our organism with food. Food and energy value of the food rations doesn't meet hygienic standards, unfortunately. In treatment of patients, present only elements of nutrition, such as limiting of salt, sugar, and cereal replacement. Especially it concerns for obese patients. According to World Health Organization prognosis, already through 3 years, this organization predicted that doubling of obese individuals for example, with level of 2010 year. Obesity always accompanied by hypertension, type 2 diabetes, dyslipidemia, so-called cardiovascular disease risk factors, which together can increase and potentiate the risk of total and, of course, especially coronary mortality. So reducing body weight contributes to significant reduction the level of lipids in blood plasma, blood glucose, blood pressure till or to 10 to 15%. Body mass index, universal parameter for examination of body weight and for control of effectiveness of any diet or any regime of physical activity. As you can see, normal body weight is then body mass index between 18.5 to 24.9 kilogram per meter square. Overweight, then this index higher than 25 till 29.9 and obesity, then this index between 30 to 35. If more, above 35 kilogram per meter square, it is already extreme patient with very high risk of all cardiovascular diseases and cardiovascular deaths. The main purpose of healthy diet for patients with high risk, of course, correction of cholesterol level. And now we'll discuss a main educational program for patients with hypercholesterolemia, which recommends a diet of American Heart Association. This diet consists of 2 stages, 2 steps. Step 1 comprises less than 300 milligrams of cholesterol per day. Fats make up no more than 30% of energy intake, and saturated fats less than 10% daily. If this stage is not effective or not enough effective, we have to start stage 2. Or this diet we should start for all patients with coronary heart disease. This diet limits the maximum intake of cholesterol, less than 200 milligrams per day, and saturated fatty acids, less than 7% of caloric intake. On this picture, you can see a famous figure, geometric figure, so-called pyramid, nutritional pyramid. According to this pyramid, maximal basis and maximal square takes water, at least 1.5 liters fluid daily. Second level takes carbohydrates. Next step, it is 3 servings of vegetable and 2 servings of fruit. Together, it should take not less than 400 grams of fresh fruit and vegetables. Next level, less, of course, less square than previous. Protein groups, milk, proteins, and meat. Meat and fish together. Meat, fish, and nut group. And last, minimal. Sweets, fats, and oils. Together with calcium, vitamin D, and B12, which we said. Which you have to add to our diet. Also, I have to remind for you about dietary sodium restriction, important component, especially for prevention of arterial hypertension. There's evidence of causal relationship between sodium intake and blood pressure. Intensive excessive sodium consumption, more than 5 grams sodium per day, or 1 small teaspoon, has been shown to have press effect and be associated with an increased prevalence of hypertension, especially with increased age. Recent meta-analysis trials showed that the reduction of 1.75 grams of sodium intake per day was associated with a mean around 5 millimeter mercury reduction for systolic blood pressure. Patients with A more pronounced effect for people with hypertension. So for all, recommendation for all people with confirmed cardiovascular disease, we should recommend to absolute restriction of salt. As for control of cholesterol level, after 4 to 6 weeks and 3 months prescription of diet stage 1, we have to control cholesterol level and reach desired LDL cholesterol level, then every 3 or 6 months control. If in case of failure, appointment of diet stage 2 with more strict limitations. As for prophylactic application of medication to reduce the risk of complication, it will, of course, so-called secondary prophylaxis or prevention of any complications or even disability. For all patients with confirmed diagnosis of coronary artery disease or atherosclerosis, and for so-called healthy people with high risk of cardiovascular complications by SCO model, should recommend. For example, hypolipidemic therapy or statins. And now, conclusion of our lecture. You should understand very good that timely and well-organized preventive work will significantly reduce the level of cardiovascular disease prevalence, mortality, permanent disability. Serve as a basis to increase the duration or life expectancy and improve the life quality of our population or population of our countries. Let's follow this recommendation and step by step, day by day, we will achieve more long and more healthy life for our patients and for us too. The last lecture is over. Any questions for me, I can answer. Thank you for information about present students to the chat. If you have any questions, then our lecture is over. See you 2 weeks later in March 11th. Bye, be healthy, and good luck for you.